Good afternoon, everyone. My name is Dr. Iwona Kasior. I'm an associate professor in the Department of Physical Therapy at Howard University in Washington, D.C. I'm originally from Poland, but I've been living in the States for quite a time, but I never lost my beautiful Polish accent. This presentation will talk about the effects of Peloid and Balneotherapy on arthritis. It was done jointly with my former students, currently Doctor of Physical Therapy, Miriam Szyłbir, and my colleague from Poland, Ewa Zasadzka from the Medical University of Poznań. In Poland, we use quite a lot of the natural medicinal treatment in physical therapy. So this presentation was really aimed more for the American public, American physical therapists or students, since we really do not use much of the natural medicine in physical therapy intervention. The history of physical and balneotherapy dates back to the ancient past. Humans were searching for healing remedies in the surrounding environment and nature, and they discovered the healing effects of heat, cold, solar radiation, and mineral waters. They were based on the instinct and observation of nature and the animal world, and that observation paved the way for primitive but effective medicinal behavior that later in the future spread to ancient Greece, Rome, and countries around the Mediterranean Sea. We will talk mainly about the use of that treatment on the osteoarthritis. Most of us know that the arthritis is the most common cause of the disability in the United States and other Western countries too. Over the decades, the prevalence of arthritis in the United States has increased significantly. More than 22% of American adults, that comes to about 52 million people, suffer from arthritis or the rheumatoid condition. Prevalence of arthritic condition among the age groups are like 7.3% in the younger population, 18 to 44, 30.3% in the middle ages, at the 45 to 65, and close to 50% among the people 65 and older. Women are more affected than men, and it's being estimated that by 2030, the number of people who will be diagnosed with arthritis will increase to 67 million. And just brief background about osteoarthritis. It occurs when the protective cartilage that supports and cushions the ends of the bones wear down over time. Most commonly affects the joint of hands, knees, hips, and spine. Risk factors: age is number one, but also obesity, which is skyrocketing in the United States, play a big role. And of course, joint injuries, repeated stress on the joints. Symptoms: pain, tenderness, stiffness, loss of flexibility, bone spurs, swelling. Peloid therapy. Peloids have been used for centuries, as I mentioned previously. Mud baths, which come from sources as lakes, volcanoes, and hot springs. There are testaments of the use of the mineral medicinal waters in ancient as Assyrian, Babylonian, or Egyptian cultures. The custom has become widespread in Europe and are known as a balneo and therma. Peloid is a mud or clay that is used for the therapeutic purposes. And anti-inflammatory and antimicrobial and antioxidant properties affects the skin. The peloids consist of dissolved and mineralized purified therapeutic mud, which is then applied to the body as the form of thermal therapy. Peloid is filled with decomposed aquatic plants, which are given through the hot temperatures. The heat that is generated from the application of the peloid improves the blood flow, blood circulation rate, and local metabolism in the body. The goal of peloid therapy is to relax muscle, reduce swelling around muscle tension, and to strengthen any anti-inflammatory activity in the surrounding that is occurring within the body. Peloid therapy is used to treat diseases as rheumatism, inflammation, neuralgia. Balneotherapy, that is the use of baths containing thermal mineral water from natural springs at a temperature of at least 20 centigrade and with a mineral content of at least 1 gram per liter, has been used for centuries to treat chronic skin and musculoskeletal condition. Underlying mechanism that temperature-induced vasodilation in the skin release the beta endorphins and enkephalins, and also has immune suppression effect on the skin. Effects of the mineral salts, sulfur has a keratolytic effect, increases oxygen in the skin, and has also immunosuppressant effect. And magnesium reduces antigen presentation. Peloid and balneotherapy management in arthritic condition. So several studies discuss the effectiveness of peloid and balneotherapy in regards of various arthritic conditions such as osteoarthritis, rheumatoid arthritis in comparison to other intervention such as pharmaceutical and physical rehabilitation. Mud bath therapy has been reported to prevent arthritic condition as well to manage them. Balneotherapy and mud bath therapy has effect on pain, quality of life, as on lung functional capacity. Patients who undergo treatment related to balneotherapy and peloid therapy have been shown to improve their physical activity and decrease pain. Studies have shown that peloid and balneotherapy have systemic activity that cause alternation with biochemical and molecular parameters. Biochemical and molecular parameters include reduced amount of plasma tumor necrosis factor, which is responsible for reducing pain and minimizing the inflammatory process, and thermal stress from the intervention is due to thermal stress which stimulates the metabolism of chondrocytes, which produce the joint cartilage protective effect. Research has also shown that the mud baths with reduced pressure and temperature decrease pain in patients with arthritis. Plasma levels of beta endorphins are raised after spending 2 hours of bathing, along with reduced serum concentration of prostaglandin and leukotriene. Mud pack therapy has a protective effect on the cartilage and induce pain relief by reducing the inflammatory reactions. Prostaglandins is a group of lipids made at the site of the tissue damage or infection. They play a role in promoting and resolving inflammation. Leukotriene, inflammatory mediator present in arthritic joint. Treatment of osteoarthritis is most commonly treated with the medication, physical therapy, and sometimes surgery to help reduce the pain and maintain movements. Balneotherapy, with regard to treatment of patients with osteoarthritis, has shown positive effects on the treatment of symptoms and quality of life. A study conducted on the effectiveness of balneotherapy on patients with knee osteoarthritis also indicated significant improvement in the quality of life of the participants. Other treatment approaches, medication, acetaminophen, non-steroidal anti-inflammatory drugs for pain management, transcutaneous electrical nerve stimulation, cortisone or other lubrication injection, joint replacement surgery, which include the hip, knee replacement, but it always has some risk of infection or blood clot. So the purpose of this targeted systematic literature review is to examine the relationship between the treatment of Peloid and balneotherapy on patients with arthritis in reducing pain, arthritic symptoms, and increasing their quality of life. Our research questions were as following. Does Peloid and balneotherapy affect pain levels in patients diagnosed with arthritis? Is there a difference between the effect of Peloid and balneotherapy in treating people with arthritis? Is there a difference in quality of life when both Peloid therapy and physical exercise are being used in treating arthritis? And our hypotheses were that the Peloid and balneotherapy has a positive effect on reducing the pain, inflammation, and other arthritic symptoms, as well as increasing the quality of life. The study utilized a systematic review to answer some of the above-mentioned research questions. The database used for this literature review included PubMed, Google Scholar, Sinhal, and ScienceDirect, and the articles were no older than 10 years. And the search word we used was the balneotherapy, Peloid therapy, arthritis, osteoarthritis, quality of life, rehabilitation, functional performance, physical activity, and pain management. And for our inclusion criteria, we decide that the articles of 2B were the one that we include in our research. And we came up out of 61 articles that were talking about the related topics. We came down to 5 articles that were more closely evaluating the balneo and Peloid therapy. Onat et al. In 2020, the study conducted in Turkey, there was a group of 27 people treated with PT alone and group of 19 patients treated with physical therapy and balneotherapy session for 20 minutes. And the PT performed daily in a provisional pool equipped with a filtering and water recirculation system for 5 days a week. Water was cooled to 38 degrees centigrade for balneotherapy. All patients had PT consisting of hot packs, tents, ultrasonography for the knee region, 45 minutes a day, 5 days a week for 3 weeks. Espejo et al. Also in 2020, the study was conducted in Spain. There were 11 daily sessions of Peloids, application of Peloid by brush, heated to 30 centigrade, a drying period of 30 minutes in the solarium spa, thermal water bath for 15 minutes with Peloid, and removal of the Peloid with thermal jet for 2 minutes. Varsatie, conducted in Lithuania, 10 mineral water bath plus physical therapy or mat application procedures, plus physical therapy or physical therapy alone every other day. Effectiveness of treatment was assessed on the basis of clinical parameters, walking speed, time of sit down, stands up, circumference of thigh, knee, and calf, flexion extension ranges, flexion extension strength, and visual analog pain scale. Güngen et al. Also study conducted in Turkey. Patients with the diagnosis of knee osteoarthritis were assigned to two groups and treated with the local natural mineral-rich mud pack or hot pack. Treatment applied for 6 days a week for 2 weeks as a total of 12 sessions. WOMAC index, Nottingham health profile, and also post and the baseline assessment, and also 3 months after the treatment. Visual analog range of motion and 15-meter walking time was used as the outcome measure. Aksoy et al. Also study conducted in Turkey. Patients were randomized into two groups. One group of 33 people underwent Peloid therapy over 2 weeks, 5 sessions a week, and home exercise program. The other group received only home exercise program. And again, in the exclusion criteria, we, like I said previously, we had 61 articles, but we came down to 5 articles that were mentioned before. This slide just showed the ways of elimination of the other article. In this table on the results, the characteristic of studies includes that in the systematic review, there are 3 studies in which the treatment approaches include mud therapy, and in 3 studies, the treatment approaches was balneotherapy. In one of the studies, the treatment approach was mud pack therapy combined with balneotherapy. And among the 5 studies, 3 of which utilized the WOMAC as an outcome measure, while remaining 3 studies utilized visual analog scale as the outcome measure. And one of the study included both. And it's here just abbreviated the, intervention, properties of and ingredients of the mud, duration of treatment, outcome measure, and the pre and post treatment assessment. This is just the WOMAC, Western Ontario, and McMaster University's osteoarthritis index as a one outcome measure, and the visual analog scale as the other outcome measure. So under our results, all 5 articles demonstrate statistically significant difference in the treatment use of balneotherapy and or Peloid therapy on reducing symptoms of osteoarthritis and increasing quality of life. So all those 5 articles shows the p-value of less than 0.05, which means that those the outcomes and the results were statistically significant. So in our discussion, this systematic review included 5 clinical studies, 2 of which showed the effect of balneotherapy, and 3 of them showed the effect of Peloid therapy on pain relief, functional improvements, and quality of life improvements. The results on this literature review favored balneotherapy and Peloid therapeutic intervention compared to standard treatment for reducing symptoms of arthritis, which includes pain relief, stiffness, quality of life, and functional improvements. Funding demonstrated that the use of balneological and Peloid intervention, such as hot mineral baths or mud Peloid treatment, improved pain and stiffness due to chemical properties of the therapeutic modalities. So those effectiveness of balneotherapy and Peloid therapy can be explained due to a thermal, mechanical, chemical effects of the intervention. The thermal effects lead to increase of blood flow and vasodilation, which results in increased blood supply and the removal of nociceptive elements. The application of heat enhances the repair of the inflamed tissue, alters pain sensation as shown in the gate control theory. The immersion of the body in mineralized water bath allows for easier joint mobility along with the facilitation of muscle strengthening and relaxation. In return, the increase in joint mobility and muscle relaxation has been shown to alleviate arthritic pain symptoms and thus increase quality of life. And of course, like in every study, there are the strengths and limitations. A strength of the systematic review is the inclusion of randomized control design studies which allowed for the minimization of selection bias. However, the limitation of the study include the different location of the spas and where the therapies took place, along with the small number of included studies which use the same outcome measures such as WOMAC or visual analog scale. And the limitation also include a limited research available, which reduce the generalizability of the systematic review. Under a conclusion, the systematic literature review suggests that there is a positive role in the use of balneotherapy and mat therapy in the treatment of osteoarthritis. These studies demonstrate that there is a significant reduction in pain and stiffness and improvement of quality of life. However, further research is needed in order to identify the strength of the relationship between the use of balneotherapy and Peloid therapy on arthritis, along with the long-term effects of that intervention. So our hypotheses were correct according to those studies that the Peloid and balneotherapy play a significant role in the reduction of pain, stiffness, and improving the quality of life in patients suffering from osteoarthritis. Takeaway information is that implementing these treatment methods for osteoarthritis can decrease the tendency for patients to utilize and become dependent on pain medication. Localized immersion of arthritic joints help to decrease pain, inflammation, and thus decreasing patient symptoms and increasing overall quality of life. Thank you.